Getting inside the patient's head. Hello and welcome to the channel. Random question to you to kick off this video. Have you ever noticed that when you yawn, you induce yawning in others around you? When two or more females of whatever species, human, mammals, whatever, are able to synchronize their cycles seemingly at will, or unconsciously even, have you witnessed this? There is this social mirroring that goes on all the time that is mostly amusing, like when you notice your child make a gesture that mirrors you or the other parent. Sometimes scary or disturbing, like when cult members mirror their leader, or when gangs go full feral and recreate the crimes of their ancestral predecessors. Sometimes I mirror a patient or vice versa. Sometimes I find that they affirm an observation I have made about them. One such occurrence reminded me to make good a promise I made on a previous video. In that video, I promised to come up with more patient archetypes that I notice in my interactions with patients on a daily basis. In this interaction, I was reviewing a patient's progress after a stint with a particular physiotherapist. It wasn't so much that the patient had made such good progress after her physiotherapy sessions that interested me, and don't get me wrong, I was certainly pleased she was better. It was more her ardent enthusiasm about not only reporting that the physiotherapist was good, and he was, but that I ought to recommend him to my other patients. She was more interested in promoting that physiotherapist than evaluating her own progress after her rehabilitation. Now, I had already pegged this patient as a publicist, one of the archetypes I shall discuss in this video. And that is a patient who goes out of their way to recommend service providers to others. What struck me is that she seemed to be reading my thoughts accurately, as she literally used the word publicist when she joked that she was actively promoting this physio, even mentioning him in her Facebook page. I was spooked by that because I was thinking about her publicist personality when I was engaging with her on the consultation. As I mentioned in the previous video on this topic, it is important for any doctor interacting with any patient for any length of time to understand quickly the psychology of a patient in order to tailor their care more closely to the needs of that patient. Yes, in this sense, a general practitioner gets the biggest slice of the cake because even though we have limited time with our patients, just like the specialists, we at least have repeat goes at this skill as we build a relationship with patients over years in some cases. In this sense, emergency doctors get the least time to develop this luxury of a skill because no one wants to know whether you're claustrophobic if you have to get into the MRI scanner ASAP because you may be bleeding from a burst artery up there in your brain and the neurosurgeons want to literally get into your head before it's too late. And yet, in emergency cases, there is sometimes a need to use knowledge of the patient's psychology to help them, as I discussed in the previous video on this topic. Patient psychology plays a critical role in shaping the interaction between patients and their healthcare providers. How patients perceive their health, process medical information, and respond to their physicians can be deeply influenced by psychological factors. Understanding these factors helps to enhance doctor-patient relationships, ultimately improving medical outcomes, patient satisfaction, and overall trust in the healthcare system. One of the most common psychological factors impacting doctor-patient interactions is anxiety often triggered by concerns about diagnosis, treatment, or procedures. Patients who experience high levels of anxiety or fear may find it difficult to communicate openly with their doctors. They may be hesitant to ask questions, even if they do not fully understand the medical information presented. For example, a patient fearful of a possible cancer diagnosis may avoid discussing symptoms, leading to delays in diagnosis and treatment. Additionally, anxiety can also impair patients' ability to retain information and follow medical advice, thereby making their overall health a little bit worse in terms of their health journey. Healthcare providers who recognize these psychological barriers are better equipped to adopt a compassionate, empathic approach, helping to alleviate anxiety and encouraging open communication. Studies suggest that physicians who establish a calm and supportive environment can significantly reduce patient anxiety, allowing patients to express their concerns more freely and engage more actively in the consultation process. Trust in a healthcare provider is a cornerstone of effective medical treatment. Patients who view their doctors as authoritative and trustworthy are more likely to engage positively, follow medical recommendations, and disclose sensitive information that may be critical for diagnosis. Conversely, patients who lack trust in their physicians may withhold information, question medical advice, or seek second opinions frequently, potentially complicating their treatment journey. Patient psychology often dictates how this trust is formed. Factors such as past medical experiences, cultural background, and personal values all influence the level of trust a patient places in their healthcare provider. Patients who have experienced medical errors or ineffective treatments in the past may be skeptical, while those who perceive their doctor as attentive, knowledgeable, and respectful are likely to have a high level of trust. When trust is established, patients are more likely to share details openly and adhere to prescribed treatment plans, fostering a more collaborative, responsible relationship that benefits both parties. Patient psychology also includes what we call health literacy, which can shape how patients interpret medical information. This has actually nothing to do with actual literacy or level of education or job profession, and has everything to do with knowledge of a specific condition, either that the person suffers from themselves or a friend or relative suffers from, such that the person is in a carer position with respect to that illness or condition. Patients with low health literacy may struggle to understand medical jargon or the significance of their diagnosis, leading to misunderstandings and sometimes even non-compliance, not taking their tablets, and may also influence how they respond to medical advice in general. Doctors can counter these effects by using clear, simple language and verifying that patients understand the information provided. By assessing a patient's level of health literacy and being aware of potentially harmful health beliefs, physicians can tailor their communication strategies, which in turn can promote better compliance and enable patients to make more informed decisions regarding their own health. In the previous video, I talked about the engineers and the specialists. These two groups of patient archetypes are highly health literate, so much so that they often know a lot more about a particular illness than the doctor. And this is no exaggeration. So, identifying an engineer or a specialist is useful to avoid appearing patronizing to the patient. Emotions such as anger, sadness, or embarrassment can significantly impact the doctor-patient relationship. For example, patients with chronic conditions may experience frustration, leading to impatience or hostility during consultations. Similarly, feelings of shame or embarrassment about certain symptoms can lead patients to avoid discussing them altogether. Physicians who recognize these emotional barriers can take steps to create a non-judgmental and understanding environment, encouraging patients to be more honest and forthcoming. Empathy from doctors is a powerful tool in managing these emotional states. When doctors actively listen, acknowledge the patient's emotions, and respond with compassion, it can create a therapeutic environment that helps patients feel understood and respected. Emotional support from healthcare providers has been shown to increase patients' willingness to share personal health information and adhere to treatment regimens, ultimately strengthening the doctor-patient relationship. In recent years, there has been a shift towards patient-centered care, where patients are encouraged to take an active role in their healthcare decisions. Psychological factors such as self-efficacy and empowerment can greatly affect a patient's willingness to participate in shared decision-making. Patients who feel empowered are more likely to ask questions, seek clarification, and collaborate with their doctors, while those who feel disempowered may adopt a more passive role, limiting their engagement and potentially leading to dissatisfaction with care. As I tell my own patients, I'm not a dictator. I'm more like a partner in your health journey. Doctors can foster a sense of empowerment by involving patients in the decision-making process, providing them with options, and respecting their preferences and values. This not only helps patients feel more in control of their own health, but also promotes a stronger, more collaborative relationship, enhancing both patient satisfaction and the likelihood of positive health outcomes. Patient psychology, encompassing factors like anxiety, trust, cognitive biases, emotional states, and the need for autonomy, profoundly shapes the dynamics of doctor-patient interactions. When healthcare providers take the time to understand and address these psychological factors, they can foster a more supportive, trusting, and effective relationship. For me, even more interesting and useful is to identify the personality, in inverted commas, which pertain to the patient's behavior in consultations, or how they react to information about their health and procedures like surgery, injections, infusions, wound care, etc. With this in mind, I present to you further patient archetypes, in addition to those in my first video on this topic, that I have definitely seen in action, and how this influences my interaction with these patients. The first archetype I'm going to discuss is the parent-grandparent archetype. This type of patient is unsurprisingly almost always older than the doctor. But I have to say, this is not exclusively so. I have seen younger patients play this role with doctors, and it is bizarre to witness, but having studied it closer, I conclude that there are triggers from the doctor's own personality that can induce this in patients. By the way, here is another promise. I shall make a video in the near future on doctor archetypes. It's a two-way street, you know. The parent-grandparent archetype adopts this persona of being your family elder every time they come to see you. They may call you son or girl or baby, and they are not shy about using these kinds of names for you, even in the waiting room in full view of other patients or in front of your staff. In fact, they address your staff in the same way. They ask you how you are even before you ask about how they are doing. They want to know if you ate your lunch or went to bed early. They are oblivious to your protestations that you are not 12 anymore. They don't care. Some, not all, come from cultures where family ties are very strong, and they are almost always women of a certain age. They want to matchmake you. They are much more tactile with you than they should be, but again, they don't care. When they are accompanied by their actual son or daughter, you quickly realize that they infantilize their children, their adult children, in the same way as they infantilize you. And in fact, you are just another in a long line of their adopted children. In some cases, the parent-grandparent archetype has no children, but they are maternal or paternal towards you in much the same way as those with a large brood. This type of patient will spend much of their consultation regaling you with tales of their family drama or showing you their holiday pics. I used to discourage this kind of interaction with me when I knew no better, but now I see that it is highly therapeutic for them to interact with doctors in this way. It is highly advantageous if I can discuss their medical context or their medical problems in the context of their latest cruise around Southern Europe, for example, because they're in a better mood to engage with me if I'm, in a sense, part of the family. There is something in the psyche of this particular archetype of patient where including you in their family circle helps them to engage better with you. So I let it happen organically, and I find it helps in my communication with them and indeed with their children, with the rest of the family. Close in personality to the parent-grandparent is the carer. The carer will also ask you how you are, if you slept enough last night, if you had a holiday recently, but without the parent energy. They are just politely interested in your well-being, but they don't let it overshadow their own health issues. They often share health tips with the doctor, and when they hear of a new health fad, they are happy to share and discuss it with you. Carers, like parents, grandparents, often bring gifts to the healthcare providers and often invite them to their homes. They are not stalkers, don't worry. They just have a sense of giving back somehow to their healthcare team. In general, carers retain their generosity to healthcare providers even when they fall out with them. Having studied carers extensively, I can tell you that they are the ones who need the most empathy from doctors. They need very gentle handling. They are often very gentle themselves and often quite sensitive. The only patient archetype who have told me that they like my quiet voice are the carers. In my experience, they connect at a deep level with other people in general, and especially their healthcare providers. And as such, they need sincerity and authenticity. The minimalist. These are the patients who keep their distance from me. Not only because they are well and don't actually need me, but because they actually do like to keep their distance. They are like that. The minimalist comes to see me not more than once a year. They come for their checkup when it is absolutely necessary, and for the rest of the time, not a peep out of them. whatever their health status may be. They believe in keeping distance from the doctor for their own health. And when they do come, they see it as a failure. Minimalists are the ones who respond best to medical technology. They love telemedicine. They prefer to email or send letters and avoid direct contact. They are the enigma of the patient population, and as such, I don't know them very well. They don't easily present themselves to be studied. The philosopher. This type of patient likes nothing more than to come and have a philosophical dialogue with a doctor. I think the philosopher is a closet minimalist because they don't actually come often, but when they do, they are quick to deflect the conversation from their health issue to anything else, including the presidential election or global warming. The philosopher is almost always male. They can be young or old, of whatever economic background, but what I do notice about them is a history of political activism in their background for some reason. They tolerate long silences in consultations and actually welcome it. Philosophers, in my experience, do not need much explanation of medical terms or the ins and outs of their condition because they have their own internal compass that guides their understanding of life, health, and death. They are happy to just gauge the input of the doctor, but they definitely lead the conversation during consultations. I often spend more time with philosophers than I do with other patients, and yet I come out with the feeling that we achieved not much. But I think this is the point with philosophers. They are not aiming for a specific goal. They just like to philosophize. It took me a long time to get this, but when I did begin to understand what they are about, I relaxed more, and now I feel like I achieved something with philosophers. I don't come away with this empty feeling, that sort of heart sink feeling that, oh, that was a waste of time. I don't have that anymore because I understand their psychology more. We have already touched on the publicist a little bit. The publicist is a social butterfly and is usually extremely well connected in the community, whether it is online or offline in real life. It's usually a woman, and she can only be described as a queen bee. She is usually extrovert and is popular, especially with hospital and practice staff, not only doctors and nurses. Publicists tend to volunteer for hospitals and practices and are great for raising the energy wherever they go. They are not necessarily carers in their relationship with doctors and other healthcare professionals, in that to your face they are not necessarily friendly or interested. Their publicity work is almost always remote, at a distance. They may also be minimalists, by the way. They maintain loyalty, but at a distance. Publicists are the most likely to stop a doctor in the street and say, I remember when you treated me for X or blank disease 7 years ago in blank hospital, and I never forgot you. Or to a nursing assistant, they may say, I remember when you got me a cup of water or a cup of tea after my operation when I could not get up from my chair. And then you ask them how long ago that was, and they say, 15 years ago. Publicists have scarily long memories and are unbelievably gracious people. Last but not least, every hospital, every practice has a tornado. This patient is the force of nature that everyone knows of and is the very heart and soul of the hospital or practice. I don't quite know what it is about the tornado patient archetype, but they are usually larger than life. They are free spirits and they make their own rules. They are entertaining, brash, sometimes annoying, incredibly disruptive, but at the same time, strangely likable. In the emergency departments of every hospital, it is the frequent flyer alcoholic and drug-addicted, often homeless patient who rolls in at all hours. In the general practice, it is often a mentally ill person with frequent outbursts who brings drama to the waiting room. The tornado is often a patient with a serious condition who is actually very ill, and their disruptive behavior is only one symptom in amongst a myriad of health and social problems. Tornadoes drain you, but it gets incredibly quiet and sad when one day they are no longer there. In my practice, we recently lost a tornado. I dedicate this video to them. What is your own patient archetype, if any? Do you think it is useful for doctors to study patient behaviors? Or do you feel like a lab rat when a doctor like me shares what goes on in our heads about what we think is going on in your head? Whatever you think of this topic, please do let me know. I'm interested. I want to get in your head. If you have any questions, these are welcome too. Go on, ask a doc.